Anna Foster. BBC Radio Newcastle.
It is 7:20 right now. Thank you very much for your company. Anna here with you through until 10 o'clock today. So we've been chatting about hoarding and the fact that more and more people are needing help with hoarding. I think it's safe to say that many of us have felt pretty anxious, or certainly more anxious, since the start of the coronavirus pandemic. And in the last 18 months, more people seeking help for hoarding issues. And that's obviously linked to anxiety. So what is it? How can you get help? Well, we're chatting about certainly more than just needing to declutter or, me buying too much stuff from a charity shop. We can talk now to Dr. Stuart Sadler, who's a clinical psychologist from Newcastle Psychologist and Counselling Clinic. Thanks ever so much for being with us this morning, Stuart.
Hi, Anna. It's good to be here.
Yeah, lovely to chat. So just explain what it is, Stuart, because I think a lot of people don't fully understand what hoarding is.
Yeah, so I think to a lot of people, hoarding, it's just about collecting things, isn't it? A lot of people think it's people who have too much stuff, but hoarding is actually quite a big problem. There's been a rise in it. So people with problems with hoarding, they have difficulty throwing away or discarding items because they have this perceived need to keep them. They might have distress at the thought of getting rid of items or throwing them away. There can be a big accumulation of them around the home, and it can actually lead to quite a few problems and dangers around the house.
It's almost a sort of a compulsion, isn't it, really? Which is very difficult to break.
Yeah, absolutely. It did used to be considered to be linked quite strongly to OCD, and there is still quite a lot of overlap with it. But more recently, hoarding disorder, it's been considered something in its own right.
And how is it linked then to lockdown and the coronavirus pandemic? Why do you think it's gone up so much?
Well, we saw quite a big increase, especially at the beginning of lockdown. And some of it seems to be that one of the big triggers for it can be about stress and lack of control. So obviously during the first lockdown especially, where people were spending more time in the house, the increased stress from that probably played quite a big part. And also as well, spending more time at home, the little things that maybe weren't such a problem because we were able to go out, do things, go to work and so on. All of a sudden, life got stuck at home. And so those little things that maybe did bother us before started to have quite a big impact.
What are some of the items that people tend to hoard? Because it's not, it really worth saying, it's not just going out and panic buying loo rolls. It's not about that, is it? So just tell us about what some of the items are that you've seen and had experience of.
Yeah, it's quite an interesting one because hoarding, it can be pretty much about anything that is collectible. So I've seen it quite a lot with newspapers tend to be the classic ones, but It can be clothes or shoes, it can be packaging, it can be rubbish, litter. It can even be animals or email. There's a lot of people where they just fill the house with animals, and we all know someone who has quite a lot of pets, but for some people, it can get to a point where there's too many to look after, and the health of the animals can suffer as well.
And you mentioned it can be dangerous. Obviously for the animals, but in different sort of forms of hoarding. Just talk to us about the dangers involved in it.
Yeah, well, for the individuals themselves, the house can become so cluttered. I've actually been in people's houses where it's difficult to open doors. So obviously there'd be a fire risk there if there was a problem. Some people who tend to experience hoarding tend to be older people who might have an increased risk of falls already. So it can be a problem there. There can be injury from items falling over. It can cause family conflicts as well. Loneliness and social isolation because of the shame or embarrassment that might come from it.
It's quite interesting. This is purely anecdotal, but I do know a couple of people that have suffered with this. And one of the things that they find very hard is leaving the house. And that's not to do with not being able to get out. That's just, I guess it's just to do with sort of almost like an agoraphobia, a fear of leaving.
Yeah, well, I mean, hoarding is considered an anxiety disorder as well, so it's not uncommon for it. It's actually more common for it to present with other things as well as just the hoarding behaviour. So quite often there is a background of anxiety there, and quite often a sense of perfectionism, or there can be other elements of phobia or elements of trauma to the person's background.
And is there hope, finally, Stuart? Just tell us there's a bit of hope.
Yeah, absolutely. It's something that can be treated quite effectively with cognitive behavioural therapy, and there are other therapies like acceptance and commitment therapy that are looking really promising and being able to help with it. For anyone who's having trouble, the best approach really is seeking counselling or seeing a therapist to help.
Yeah, absolutely. And if you do that, you'll get your freedom back. Stuart, really nice to chat to you. Thank you very much for talking to us. If you have got any experiences of this as well, it's always really good to hear it, from the horse's mouth, to hear your experiences. 81333, start your messages with BBC. It will be great to hear from you. It is 7:26 right now.
Anna Foster. BBC Radio Newcastle.